Hi. Now I have the pleasure of interviewing you two gentlemen. I'd like to introduce you to start with. Dr. Georg Handwerker is a pediatrician practicing in Passau, Germany, and he is founder of a Neurofeedback quality circle here in Bavaria, where various healthcare practitioners exchange their experiences with neurofeedback. And Dr. Jørgen Axelsen is a research assistant with Aarhus University in Denmark and the founder of a non-profit organization called Stronger Brains, and we're going to talk a little about that later. Now I'd like to start with you, Dr. Handwerker. How have you come to incorporate neurofeedback into your medical practice for children and adolescents?
I was doing developmental and neurologic examinations with children for all of my professional life, and I was always involved in EEG and treatment of disorders where you need to take an EEG, for example epilepsies, but also in my training I was in a social pediatric center and treated a lot of patients with developmental disorders like ADHD. And during this time I came in contact with neurofeedback and found it an interesting field and also a very efficient method of treating various conditions, and that's why I decided to include that into my practice.
And how about you, Dr. Axelsen? As a research fellow, what has sparked your interest in neurofeedback?
It was a coincidence, but first of all I have to say that my interest in neurofeedback does not have anything to do with my work as a senior scientist at the university.
Okay.
It has something to do with that my daughter, by chance, moved to or bought a house next to one of the neurofeedback therapists in Denmark, one of the very few ones. And later on she needed some help from the therapist, and by that we discovered that it was functioning. And after some years now we have realized that several of we have 4 kids, they have received training from of neurofeedback training and benefited very much from it. So it has played a big role for the happiness of our family, we can say.
Okay. So obviously neurofeedback has convinced you, so much so that you were motivated to found a non-profit organization called Stronger Brains. Would you tell us a bit about the mission of Stronger Brains? What is your aim?
The mission of Stronger Brains is to disseminate the knowledge about neurofeedback in Denmark. Neurofeedback is virtually unknown in Denmark, and we feel that a lot of people could benefit from it. And the idea with our organization, Stronger Brains, Science and Education, is to disseminate the happy message of neurofeedback, you can say.
Okay. Now, Dr. Handwerker, in your professional opinion, what is your view on the general awareness and the perception of neurofeedback here in Germany?
I think neurofeedback is received very well in the medical community at this moment, especially concerning treating of children and adolescents. It is used for various indications, but one of the most important is attention disorders. And also there has been some research in Germany on this type of therapy. The therapy is present in Germany in the consciousness of therapists and psychiatrists for quite a while, I think for the last 30 years at least. But there are only few places where you can actually do the therapy. It changed a little bit during the last 15 years or so, especially since a larger number of occupational therapists use this therapy form now in their occupational therapy.
Okay. And what about you, Dr. Axelsen? How would you describe the situation with neurofeedback in Denmark?
there's not so much to say because it is not known as a possibility, and there are only few therapists who carry out neurofeedback in Denmark, and it is not something that is being used in our health system at all. It is, as I said before, virtually unknown.
Now, a way to get many people as many people as possible interested in neurofeedback is to disseminate the current relevant studies and research on the subject, and by doing so, more people would be attracted to view neurofeedback as a viable treatment option. And now, Dr. Axelsen, you have authored a scientific article on the number and quality of various neurofeedback studies. Can you provide us some insight into the conclusions you have drawn from that?
Yes, I can. It's so far not a scientific article I have written, but it's a little article based on scientific evidence. I searched the scientific database for literature on the two keywords, neurofeedback and ADHD. And I got a lot of articles out of it, and I had to kind of restrict the search to review articles, and there are still a lot of them. And then I found articles that were reviews of reviews, and they clearly stated that there is a positive impact of neurofeedback on ADHD. There are some of the papers that find that it is a little better than medication, and some papers find that it is almost as good as medication. But generally speaking, the conclusion is that you can help ADHD by aid of neurofeedback, and there's a lot of evidence for it.
Okay. And do you believe that publishing this work on a Danish platform could lead to greater recognition of neurofeedback as a viable treatment option?
I expect yes, but so far I don't really know exactly where to send it, but I've been thinking of it these 2 days here in Munich, and now I believe I know where to send it. I'm at least going to try it.
Okay.
Yeah. I'm going to try to have some impact at least. Yeah.
Thank you. Now, neurofeedback has been included in the treatment guidelines in Germany. Dr. Handwerker, could you elaborate on what steps can be taken to encourage a wider adoption of neurofeedback among healthcare professionals in the future?
I think you are alluding to the level S3 guideline for the treatment of ADHD,
yes.
Which was published, I think, 2 or 3 years ago. And in this guideline, neurofeedback is mentioned as one option for treatment of ADHD in the frame of a multimodal treatment for ADHD. Now, as we know, ADHD is diagnosed in Germany with a child psychiatric professional, or with a pediatrician, or with a SPZ, Social Pediatric Center. So there are different institutions and medical professionals who do the diagnosis of this disorder. And I think the people working in this field are mostly aware that neurofeedback is an option. We see it as an option amongst others. We feel that neurofeedback has a maybe greater effectiveness than other psychological interventions, but it has less effect than a medical intervention, like a medication. There are, as you already said, a number of studies and reviews and meta-studies out there. I would point to the articles of Martin Arns from Nijmegen in Holland. He did excellent research on this field, and there's an important article published 2020, so some 2 years ago, about comparison of effect size of neurofeedback to the effect sizes found for various interventions in the MTA study, which is one of the most important studies for treatment of ADHD done ever. This is an American study. And I think from the medical doctors, the awareness for neurofeedback is there. A big problem is that there are not so many providers of neurofeedback. So I think although we have a number of occupational therapists who do provide neurofeedback, and although we have some neurofeedback treatment opportunities at child psychiatric hospitals and at social pediatric centers, still the waiting lists are very long, and usually children tend to wait 3 or 6 months or even longer to get a treatment place. So I think that's the biggest problem at the moment. Also, it makes sense to put the neurofeedback into a position in the frame of multimodal treatment. So usually if a child is newly diagnosed with ADHD, the question is, what is the first intervention? And in many cases, in my opinion, good first intervention would be neurofeedback. So it's a problem if you have to wait half a year for this first intervention.
Or it is even unavailable, as in Denmark, or very difficult to get.
I see. Now that different neurofeedback methods, and Dr. Handwerker, have all of them been equally studied and evaluated?
No, you couldn't say that. There are methods which are evaluated quite well, especially band training protocols are studied in a number of trials, even with a control group or blind control group. Especially the band trainings have studies like that, and also the SCP trainings have a number of well-done studies of good quality that prove that there is an effect. There are not so many studies on the Z-score training protocols, which are protocols based on a statistical deviation of the mean of some characteristics of the EEG. But I would point to a work of Google Paris there. We can link it in the show notes. He did a comparison between a beta theta training, which is the standard band protocol training for ADHD, to a Z-score training in the same region of the brain. And he measured the theta-beta ratio before and after a number of treatments. And he found out that actually the effect of the Z-score training was better than the band training. So this is only a study with a small number of participants, but is, I think, a good example of how you could do a study with these scores with patients in a similar way. The big problem with Z-score training is that it's tailored individual training. So depending on the symptoms and the diagnosis of the patient, it can be likely, depending on the therapist of course, that for the same diagnosis you may get very much varying protocols used because of different symptoms under the same diagnosis. So there are types of neurofeedback that are tailored very individually, and this type of neurofeedback has not so many randomized or controlled studies as the protocols who are rather tailored like medication. So if you get diagnosis A, you get treatment B.
Okay, yeah. I see. And Dr. Axelsen, do the results of neurofeedback studies vary for different psychiatric conditions?
I don't have to confess, I don't know so much about that, because what I have tried to look for in the literature was only ADHD.
Yeah,
So
okay.
I've not been trying other problems. I've not been diving deeply into that.
Okay. Could
So,
you comment on that? If the results of neurofeedback studies vary for different psychiatric conditions, like it's better for
in
some-
general, there is a lot of material, or a lot of published material on ADHD, and it's much less for other conditions.
Mhm.
So if you're looking up, for example, neurofeedback and depression,
Mhm.
you will find some studies, but much less than for ADHD.
Okay.
So the evidence is quite large for ADHD and epilepsy, for
Mhm.
those two conditions, especially for focal epilepsy. And the evidence is much less for other conditions. But I think the quality of work done for other conditions has gained a lot of quality in the last years. For example, the works of Mark Derrida with pain patients pointed to that direction. There are very well done studies on a specific problem.
Mhm. And in your experience, what medical conditions have been shown to have the most promising results?
Well, as I said, ADHD and epilepsy clearly are indications that usually give very good results. But we have to emphasize, and I always tell the patients at the beginning of the therapy, neurofeedback is, in my opinion, not a means to avoid medication, but is one puzzle piece of the general therapy concept.
Now, neurofeedback therapists must be well trained and should have a thorough understanding of the various methods. What advice would you give to individuals who seek a qualified practitioner?
Well, I think one point would be that you carefully look at the information you get from the practitioner. Usually the practitioner should state where he gained his training. There are various institutions in Germany who provide training for neurofeedback, and usually the practitioners link to that institution where they got the training. Also, one important point would be if a practitioner takes part in educational, in ongoing educational things like quality circles or learning new methods of neurofeedback. I think these 2 points would be very important. And another point would be to look at what are the promised benefits. A good practitioner would never promise you, I will do it without medication, or I will do it without a doctor.
Or you will get this result.
Or you will get this and that result, right? Exactly. Yeah.
Okay. I have an additional question to that, which we did not prepare beforehand. What should patients expect from neurofeedback, or what can they expect, and what is like an unrealistic expectation that people bring to the table?
I tell my patients usually that they probably should know after 5 or 6 sessions if neurofeedback is good for them or not. If it's not good in the first 1 or 2 sessions, then probably the practitioner will switch the method of training, maybe only the method of feedback. It could also be a problem of the type of feedback chosen. But usually, if you feel some effects, you will feel them after the first 5 or 6 sessions or so. If it comes to measurable feedback effects, neurofeedback effects, it depends on the method. So in the guideline you mentioned earlier, there is the number of 20 to 30 sessions. This relates to SCP trainings. Because for SCP trainings there are published studies that show that they provide a good, strong and also lasting effect that holds on longer than the training itself. So you can, even after 6 or 12 months after the training, you can still measure effects, only if you did enough sessions. So I would also see for SCP trainings 20 sessions usually is a minimum. For other types of training, maybe 10 to 15 sessions will be enough. So it depends on the method.
Okay. Well, that was that. Do you have some concluding words, what you would hope for in terms of neurofeedback, the development in Denmark?
I definitely hope that it will get possible to get neurofeedback training through the public health service, so that it is getting available for everybody who needs it. That would be great. That would be a great achievement.
Okay. And in Germany, what would you say? What is the hope for the future when it comes to neurofeedback?
Well, I would hope that it gets more widespreadly available in Germany, and I also think providing neurofeedback via non-profit organizations like Georg Learning is a very great opportunity, especially for reaching children and families who are in the social shadow, so to say, and cannot provide the payment of neurofeedback by themselves, or have no access to it up to now.
Okay. Well, thank you for having this interview with me.
Thank you for inviting us.
You're welcome.
Thank you.
And now we move on to the next talk. Lulu Jiang is going to talk about our remote health project.
Thank you.